Hi, my name is Dr. Carrie Gans, and I'm the president of the Long Island Group for Headache Management here in Garden City, New York. What I wanted to talk to you about a little bit today was something that hadn't come about in our office just a few minutes ago. And I thought it important enough to take a few moments out of our practice to sit and generate this message. You see, one of my patients told me a story about his girlfriend or wife or whatever, who recently had some surgery because she is a chronic headache sufferer. She suffered with 25 or more migraine headaches per month, basically ruining her life. Now, the surgery was very complex, and it meant cutting muscles and putting in fatty tissue between the muscles, and I'm not going to go into the gory details, but for a time period, it actually worked. The reason he questioned me was that he came into the office and the headaches were coming back. She was fine for a while, but now that the headaches are coming back. There was really no long-term success. Now, the process may be a good process. I'm not knocking the surgical procedure, but for many people, surgery is just not an option. Now, many years ago, I ran the TMJ program, the myofascial dysfunction program at North Shore University Hospital. And for the most part, the treatment was based upon symptomatology. Patients came in with a variety of headaches, facial pain, neck pain, etc. And we would prescribe either muscle relaxants or pain medications, and then place them on some kind of intraoral dental splint to alleviate some of their bruxing or clenching. That was all we had. We didn't have much more to help them. We also had no real diagnostic data. We basically, once again, went by symptoms. So for a couple of years, we did this until such times we found that most people just weren't helped long-term. Many, not even short-term. That's all changed. So if you're one of the 45 million people out there suffering from chronic head, neck, or TMJ pain, there is a new solution. It's called Trudena. Name's not important. What is important is that there is now a system that, one, has true diagnostic data. There is now a computerized equipment that can let us know what the problems are, so that before treatment begins, we can let you know that you're one of the people that we can help. So you see, we don't want to go ahead and begin treatment on people that we just can't help, and there are some that we can, but most people we can. So we want to be sure when you start that we use this diagnostic material to make sure that you're one of the people of the 93% success rate that we're finding with this treatment modality. So utilizing all this diagnostic material is great, but then what do you do once you find out that there are people you can help? Once again, years ago, it was just medication or splints. Today, we're copying sports rehab medicine. Now, don't tell them, but that's basically what we're doing. For many years, the sports rehab people found that they could take care of athletes, football players, runners, whatever, baseball players, who suffered trauma to their joints, their knees, their elbows, their wrists, whatever. They use a variety of medically approved, FDA-approved treatment modalities to help these people repair those injured muscles. Well, we now have the same technology available in the dental office. We can now help people with head and neck pain achieve great results using such things as ultrasound, microcurrent technology, and finally something called a cold laser. Now, don't let the names mislead you. None of this is invasive. It's all superficial. There are no needles, no pain. There's nothing of that nature. No surgery is required. And the treatment lasts maybe 4 to 6 weeks, sometimes 12 weeks if the chronic headaches are severe. Now, at that point in time, you're able to treat your headaches yourself. Now, we don't claim to get rid of them totally. I don't know that anybody can. Now, in some instances, that may happen. But our goal at the Long Island Group is to basically take headaches, and instead of 25 a month, maybe knock it down to 4 or 5. Take those headaches, which may have a severity of 10 on a 0 to 10 scale, get them down to a 3. Make sure that you can go about living your life again without having to rely on medication, dental splints, living in a dark room, missing days at work, missing family events because you just can't face it, constantly losing a good night's sleep. Our goal is to go ahead and take care of all that for you. So what do you do today? Well, if you're one of those 45 million people suffering, give us a call. Our phone number is 877-626-0969. That's 877-626-0969. We'll be happy to provide you with a complimentary consultation. You and I will sit and talk. We'll find out if you're one of those patients that we can help. And if we can then set up a diagnostic visit for you where we will find out exactly what your problems are, and then we can design a program just for you. So please give us a call at 877-626-0969. Speak to one of our staff and set up that appointment. Start living your life again. I hope you enjoyed this brief video and just understand there is help out there and we can provide it. Have a great day.